Okay, today is May 28th, 2025, and the last time I did something to myself was probably 2017 with some sculpture in the upper temple here to lift the face up, and also some profiler to enhance the skin quality. I think that was 2019. And since then, I think I only did some HIFU by my assistant on the lower jaw here to tighten the lower face. Now, today I think I do need a little bit of more overhaul in various things. The first thing I would need to do is to slim down the chin muscle because I think I look a little bit too angular. And although that's very personal, some people like it to be more angular, some people like it a bit more smooth, and I would like spat and like my contour to sort of slim down in this chin muscle area to something like this, which I personally prefer. So the second one is the forehead line, like here, and the midline frown, which is getting deeper over the last few years. And so I think it's time to give it a bit of a go to do some Botox in that area. Okay, first I will do the chin muscle here first. Just clean it with a bit of antiseptic. This is a line from the ear to the corner of the mouth, which we should not inject above that line, and in fact preferably about one finger breadth below that line. So that would be the chin muscle I'll be injecting. Last one. Done. Okay, you can see the needle is very fine and there isn't really any redness or pinpoint bleeding. And this side, so I'm not left-handed, so there's a little bit of a trouble there to inject in the reverse direction. And again, this line where we should not be injecting, so about one finger breadth below this line, which is about here. This is the chin muscle. I have not worn the gloves, which I think I should, so I'll do that after I finish with this side of masseter muscle. One more. That's it. So you can see there isn't really any bleeding, redness there at all. Okay, so that's done with the Masseters muscle, and I'll come back in a minute to do this front line and the forehead horizontal lines. Okay, the next one I'm going to inject the forehead. I've got a fair few lines here, and I would be injecting in the central area here. I'll probably do 1, 2, 3. Now this too far down lower here near the eyebrow, which as I always suggest to people that we should not inject too close to the eyebrow, maybe leave it for about 1 cm, roughly 1 finger breadth away. So I think this line is the lowest I would do. I will probably do 1, 2, 3, 4 points plus 1, 2, 3, which is in deep ID, because I would not be able to inject directly straight down into the muscle. I will probably just be able to do at an angle as a deep dermal injection, let it diffuse down to the muscle layers. Okay, so the first one here. This one. Then the second one here. And the third one here. I push the skin forwards to give a bit more resistance so the needle can actually go in easier. Three. Four. Five. Six. Seven. I think I've got just about 8 to 10 units in there. Okay, there's this tiny bit of a bleeding here and here, which is to give it a press for a little while. And then the midline front glabella, which I'm going to do a standard 4 to 5 points. 1, 2, 3, 4, and 5. Okay, that's a little bit more difficult because that one need to go straight into the muscles there, and deep intradermal is not a way to do it. Okay, so you can see this 1, 2, 3, 4, 5. These are the 5 points. Okay, I'll try my best. That's the one here. Okay, go straight in. You can feel the needle in the muscle. That's one. And that's two. You can see I shake my needle a little bit, and I've got this concept from electric drill, where if you've got these hydraulic drill, the drill head will move in this kind of direction, and that will actually go into any skin structure more effectively and giving less discomfort to the patient. And that's not 2, 3, that's number 3 now. Three. There's 4. So last one is here. Done. Okay, so 1, 2, 3, 4, and 5. That's done the forehead and the midline glabella. Well, good that I did not give myself too much of any bleeding. Okay, so I just give it a wipe and give it a bit of pressure, and that should be it. And I don't think I have bruised myself. Well, that's a pretty good job to myself, I think. Okay, the next one I'll come back after I prepare is the polynucleotide, and the brand I use is Nucleophil from Italy. Now I would be hoping to improve my skin quality. I've done quite many, over 160 boxes already in the last 4 months to my patients, and I have seen amazing results in them. And I just think, I need that result too. If I give that result to other people, why don't I do it to myself? And I will hope to improve my skin quality, a bit of a tightness, firmness, improvement in fine lines and pores. Okay, and also would do the lower eye. Now, this is definitely the things I would need most to improve this lower eye bag, which I have not thought about having the surgery done yet to lift the skin. If I can achieve something like that, oh, that will give 5 to 10 years of my real age. Okay, mind you, I'll be 60 in November, so that's 6 months away. So yeah, I hope to achieve something like that, if that is possibly done with the skin tightening effect of a Nucleophil, hopefully in a couple of sessions. Okay, I'll go and prepare the stuff.